Thanks for tuning in again. I thought I'd demonstrate some of the three new exercises physical therapy has given me to do. The first one is to walk my fingers up the wall until it begins to hurt a little bit or get a little bit sore, and then to hold that for a count of 30 seconds. The second exercise she gave me was to bend over and do a circular motion with my arm like this, and I do that for a count of 60, about 60 seconds, about a minute. And I do each one of these exercises 3 times a day, once in the morning, once in the afternoon, and then again in the evening before bed. The third exercise she gave me is this pulley apparatus that hooks to the door, and I am just working the arms, and I'm to do this a total of 30 minutes per day. So I have broken this particular exercise into 3 different segments as well. I do 10 minutes in the morning, afternoon, and evening. Thanks for tuning in again and following along with my sub-adventure of my greatloop adventure. I am currently outside of the Austin Orthopedic Center, getting ready for my initial consultation with what I hope is the doctor that's going to actually operate on my shoulder. So more later as things develop. Take care. Welcome back. I have just returned from my appointment with Dr. Hurt, the person that was supposed to operate on my shoulder, and we had a really nice discussion. His recommendation actually right now in the short term is to not do the operation, rather that I work on strengthening my arm muscles and to return to my strengthening exercises, but not be quite as aggressive as I have been in the past. Some of the reasons that he recommends not surgery is, first off, he considers 3 things: the type of injury, the age of the injury, and the age and condition of the person that is injured. The age of my injury is over 6 months. The age has a relation to just the normal body functions. As you get older, your bones get less dense and your tendons get to be less malleable. And one of the things that he's concerned about with older patients, such as myself, is that the tendons get to be more brittle. And even if he was able to tack the tendons back together again, they may not stay, where they may rip, and then he'd have to redo it or do something else more drastic. And so basically really not solve the problem. And so with those considerations and seeing that I am an active person, that his recommendation is that I go ahead and start working on re-strengthening the arm, because actually some of the other muscles will begin taking care of the area that is damaged. So we're going to revisit COOP therapy, physical therapy, to get some added suggestions on exercises I can do to strengthen my arms, along with or instead of some of the exercises I have been doing. So that's it for this adventure right now. No surgery, strengthening exercises, and we'll give that a couple months and see how it goes. Thanks for tuning in. I consider this good news. Take care. Thanks.